Have you ever experienced a sudden injury to your eye, perhaps from a sports ball or an accidental poke, and then noticed something alarming like blood collecting in the clear part of your? It can be a very frightening sight, and it is a serious condition that requires immediate medical attention. Eye doctors treat hyphema, which is blood pooling in the front chamber of the eye, primarily by managing symptoms, preventing complications, and allowing the blood to naturally reabsorb. The primary goal is always to protect your vision and the long-term health of your. This blood collection typically results from trauma that tears blood vessels in the iris or ciliary body, which are structures located inside the eye. When these delicate vessels break, blood leaks into the anterior chamber, the space between your cornea and iris. This blood can block vision and, more importantly, can lead to increased eye pressure, called glaucoma, or even rebleeding, which are serious threats to your sight. Treatment for hyphema usually begins with strict rest. This means avoiding strenuous activities, keeping your head elevated even while sleeping, and often wearing an eye shield to prevent further injury. Your eye doctor will typically prescribe eye drops to reduce inflammation, dilate your pupil, and sometimes to lower pressure. They will also schedule frequent follow-up visits to monitor the blood's reabsorption and check your eye pressure carefully. In rare cases, if the bleeding is severe or causes persistent high pressure, a surgical procedure might be necessary to drain the blood. One crucial detail many people do not realize is that even after the visible blood is gone, the eye remains vulnerable. Your doctor will likely advise you to avoid certain medications, like aspirin or other blood thinners, which could increase the risk of a secondary hemorrhage. This rebleeding event is often more severe than the initial injury and can occur several days after the first incident, making continued vigilance essential. Understanding how eye doctors treat hyphema highlights the importance of prompt medical evaluation for any eye injury, especially those involving visible blood. By following your doctor's instructions for rest, medication, and follow-up care, you give your eye the best chance to heal without long-term complications, safeguarding your precious vision for the future.